Hello, my name is Susan Jacobs. I'm here to talk with you about the rising costs in healthcare. We pay attention to the rising costs in everything else, such as the gas prices for your car, the cost of groceries for your house, the cost of your electric bill. But as most people, including myself, we don't pay attention to the rising costs in healthcare. Healthcare is and will always play a major role in human life. We have to have it. We have to have doctors. We have to, have them routine checkups just to prevent diseases, illnesses, stuff like that. But we see ourselves with the economy taking major cutbacks, but a lot of people don't see the healthcare side of it, where the doctors are having to take cutbacks, where the hospitals are having to do cutbacks. A lot of doctors' offices, which are private practices, they're having to sell out to the larger companies just for job security. Because now, when a doctor is expecting to see X amount of patients a day, he might not see that many. So that's cutting into his budget. And also, where I have worked for a cardiologist for several years, I've seen cardiology take quite a hit. Cardiology they were allowed to, if a patient had prior heart conditions such as a heart attack or any blockages, they were allowed to do a stress test once a year on a patient and an echocardiogram every 6 months. Now, with a lot of insurance companies, especially Blue Cross Blue Shield, they only allow a patient to have a stress test once every 2 years and an echocardiogram once a year. This might not sound like a big change to a lot of people, but when you think of it from the patient's point of view, you could gain a lot of blockages within 2 years, or have any other issues that an echo would pick up within a year. So it really does need to go back to the way it was before. Get your echo once every 6 months, get your stress test once a year. A lot of hospitals are having to do cutbacks, whereas they would have a certain number of nurses per floor per shift. Now they're only allowing half the number of nurses and filling the other slots with CNAs. CNAs are cheaper to pay than a registered nurse for the hospital, but a CNA is only allowed to do so much for the patient. They're only allowed to check the vital signs and help with the everyday living skills, whereas a nurse is allowed to do way more. A CNA can't even go to the doctor with a problem. They have to contact the nurse, which has to contact the doctor. So there's always a chain of events that take place in the healthcare team. And with the cutbacks, not only are the hospitals and the doctors' offices having to do cutbacks, patients are doing a lot of cutbacks. A lot of patients now are going on websites such as WebMD and Google and self-diagnosing themselves because they do not want to have to pay the premiums. They do not want to have to pay the out-of-pocket expense for healthcare. When we set our daily budget or our monthly budget, we really do need to factor in co-pays, or if, like for me, I'm self-pay. I have to factor in extra amount of money in case I got hurt, in case I got sick, to where I would have that money to the side to be able to go to the doctor. I am probably the world's worst for it because I don't want to have to spend that extra money when I know that I could use that money to pay another bill, to buy more groceries for my home, to buy my kids something. But your health is serious, and you should always take it serious. And rather than going on a website like WebMD, where you might get a diagnosis from that website, but do you really know who you're talking to? You could be talking to a 5-year-old kid who's telling you you've got a cold when it could be something way worse. It could be something as bad as cancer. You don't know because you're not a doctor, and you don't know if the person on the other side of that website is a doctor. You have no idea who you're talking to. So you really need to take all these factors into consideration, and hopefully one day the economy will get better. Right now, a lot of people are saying that we're in a recession. Some are saying we're not. But with the way the cost of everyday living is just out of control, I agree that we are in a recession, and maybe one day the prices of everything will get better, and that will include the price of health care. Healthcare, it is expensive, but it is necessary. Just like the lights on in your house. They can be expensive, but they are necessary. So just please take this into consideration and take care of yourself. Go to the doctor. Spend that little bit of extra money. I know it seems like a lot, but it is necessary. Thank you.